Hi, this is Brian Wormers recording a lecture on hepatologic disorders, otherwise known as liver disorders, for medical surgical nursing. These are your learning objectives. Cirrhosis is extensive scarring of the liver, usually caused by a chronic reaction to hepatic inflammation and necrosis. Some of these things that can cause this would be lanic cirrhosis, which is related to alcohol abuse, and hepatitis C. Some of these complications really depend on the amount of damage sustained by the liver. The liver is very filled with blood. God, if I could talk, that would be great. This is Brian Wormers recording a lecture on hepatologic disorders, otherwise known as liver failure for medical surgical nursing. These are your learning objectives. Our first topic is cirrhosis, and this is scarring of the liver usually caused by a chronic reaction. Some of these things that can be causing this would be lanic cirrhosis related to alcoholism and abuse, and hepatitis C. Complications really depend on the amount of damage sustained by that liver for the signs and symptoms that you're going to see. In compensated cirrhosis, the liver has significant scarring, but does perform its essential functions without any significant symptoms, and most of the time you wouldn't know that it was scarred. Now, if it gets more severe, then we have to worry about lots more things. And some of the things that can cause this liver disease would be alcohol, viral hepatitis, autoimmune hepatitis, fatty liver disease, drugs, toxins, biliary disease, genetic causes, and cardiovascular disease. So some of the early signs and symptoms that you might see would be a significant change in weight, GI symptoms, abdominal pain, liver tenderness, and itching. Late stages would be jaundice, dry skin, rashes, especially this one near spider angiomas, petechiae, ecchymosis, which is bruising, hepatomegaly, which is an enlarged liver, bright red palms and hands, peripheral dependent edema in extremities and scrotum edema, and capita medusa, which is this when your veins are distended around the umbilicus. You can kind of see it here as well. Fitter hepaticus, which is foul-smelling breath, and then amenorrhea. Other notable signs can be gynecomastia, testicular atrophy, and impotence. Bruising, petechiae, enlarged spleen, esophageal varices, neurological changes, and asterixis can also be part of this. You can click on this to see an example of what asterixis is. AST, ALT will become elevated with liver damage because those are liver enzymes. Alkaline phosphatase levels may also increase and caused by biliary obstruction. You want to check a serum bili and a urobili, and those may rise. Your protein and albumin might decrease because you're not able to break those down. Your clotting times is going to get extended because your liver is where you make some of these clotting factors. The platelet count will be low because of that. Your H&H values and WBC might be decreased because your body's not making enough. Ammonia levels will be elevated, and that's what leads into some of your nervous system involvement and signs and symptoms. And your serum creatinine can possibly be elevated. So, as I said, you can get some neurological symptoms. Portal systemic encephalopathy is one of these, where you get a buildup of ammonia. It goes, and you can't excrete it. It builds up, becomes a toxic form, and then it causes neural changes. Some of the things we can do about this would be to limit the amount of protein and fat and simple carbohydrates that you put into your body, because that's what gets changed into ammonia. And then we can try and bind it with lactulose. It draws that ammonia into the colon, and then it's got a laxative effect, so it pulls it out with it. Antibiotics can distort that normal flora in the bowel, thus diminishing the ability of your body to break down protein. Hepatitis, lots of different types of hepatitis. Most of the time, what we're concerned about as nurses is hepatitis B and C, but there's A, related to foodborne illness. There is D, which is a spin-off of type B. There's E, which is similar to type A. Then there's G, TT, and SEN, and those are kind of newer ones that are being studied. The ones I really want you to know are hepatitis B, C, D, and E. Manifestations of hepatitis include abdominal pain, changes in skin or eye color, so jaundice, arthralgia, myalgia, diarrhea, fever, lethargy, malaise, nausea, vomiting, and itching. Some of the management of this is physical rest and psychological rest. Getting them to relax a little bit can help out. Diet therapy, we talked about that earlier, but eating good protein and clean food. Drug therapy can be antiemetics if they're vomiting a lot, immunomodulators to calm the body down, and then you've got some new ones that are coming out on the market that actually are a cure for hepatitis C. There's a lot of controversy about this because a full prescription will run about $80,000. So you can click here to see a little bit more of that and see what you think on that. Fatty liver disease is on the rise in the United States. It's caused by accumulation of fats in and around the hepatic cells. We really don't know what's causing it, but we're thinking that it's related to diabetes mellitus, obesity, elevated lipid profile, and alcohol abuse. Most of the time these patients are asymptomatic, but you might see a little bit of a rise in their AST and ALT. Liver trauma, we talked about trauma earlier, but we can talk about liver trauma specifically because it's so vascular. It happens to be one of the organs that tends to be injured in trauma, especially if you're talking about car crashes or fights. The bad thing is that it's so vascular, it receives 1/3 of the cardiac output. So therefore, when it bleeds really quickly. Anytime you mess with it, like in surgery, it tends to bleed more. So fixing it in surgery is really difficult because the more you poke and prod at it, the more it tends to bleed. So if this does require surgery, it's going to be a very bloody surgery, and it's going to require multiple blood products. This concludes this presentation. If you have any questions, please ask your instructor.